All right, y'all. Listen, every Wednesday on the Rickey Smiley Morning Show is Wellness Wednesday. We got the one and only Dr. M.J. Collier is back with an update from the medical community, and he also answers your general medical questions. So hit us up, 866-9-RICKEY, 866-9-RICKEY. Dr. Collier, good morning. I got one question.
Yes, sir, Rickey Smiley.
Man, so what's the deal with COVID? Is COVID, because I saw somebody just posted on Facebook, I know COVID is still real, but people are coming back into the office, back into the radio stations now. Where are we on COVID?
We are experiencing, again, a return of the high numbers that we had previously. We're going to have we thought it was going to be a twindemic between COVID and the flu, but the respiratory syncytial virus is also giving us a trifecta of respiratory diseases that people are suffering from. The flu is going to be the worst cases that we've had in the last decade, and so I highly encourage people to go get the flu shot now. It is not disease-causing. It cannot make you sick, but it can give you great protection. There is no vaccine currently for the respiratory syncytial virus, but they are actually trying to create one based on the same mRNA technology that created the vaccines for the COVID. So that may be available soon, but probably not this winter season. But they just had the death of a 5-year-old child from respiratory syncytial virus on the West Coast. So we're seeing that phenomena as well. So I got a couple of my office staff members are currently out with respiratory tract infections, probably the flu. And, we're having problems throughout. So the numbers are high, and we're experiencing a return of that. The temperature is dropping across the country. You're indoors now. People are breathing and coughing in your face. Wear your mask. Wear your mask. Ricky, I was on a flight last week, and I tell you, I was cringing with the number of people that were on that flight coughing and hacking.
Yeah, and when I tell you I had that mask on that flight, and I'm talking about I have it on and an ace bandage wrapped up around my face on the inside. And some spray, and some Clorox wipe, and some bleach, and some mustard clean.
Everything and wiping down everything. I definitely listen to your advice, and I wipe down. When I sit in that airplane, it takes me 10 minutes to finish wiping it down.
Man, I was doing that way before COVID. All right, let's go to the phone line. You're on with Dr. Collier. Good morning.
My 15-year-old son was diagnosed with COVID long haulers, and he's always tired, he's achy, never feels good. He had COVID 3 times. The last time he had it, they gave him the infusion treatment. And also when he was 5, he had open heart surgery. And I just want to know, where should I go, because I can't get any really help for him, or I don't know what to do for him.
Okay, he is in a high-risk category because his previous heart condition, that's really a continuing condition. But the problems with long COVID are all due to inflammation. So you need to treat them with natural anti-inflammatories. And that's why I highly recommend a treatment regimen of vitamin D3, 5,000 international units per day. Anything less than that is less than effective. So you need to use at least 5,000 international units of vitamin D3. Some omega-3 fish oil would also help with that. I'd recommend 2,000 milligrams per day, or 1,000 in the morning, 1,000 in the evening, and it's just going to take time to keep that inflammation calm down and make sure that he's up to date on the new bivalent COVID booster, because that's the only booster that they're giving now. A lot of people say, well, I already had my boosters, but you haven't had this booster, so you need to get that as well.
All right, y'all, with Dr. Collier, good morning.
Hi, good morning. My name is Candace. My 8-month-old baby has been diagnosed twice with RSV within the last 2 months. My question is this something that she can keep getting, or will she build up some type of immunity to this? I don't know what to do.
She will build up immunity to it. The second time it was diagnosed is probably still the disease state from the first time. She just hasn't lost the antibodies, so they're still being detected by the test that they use. So I don't think that's it. It probably is just a recurrence of a respiratory tract infection. But 8-month-old baby should be capable of having a good immune response and should respond better after having a secondary infection. And so just make sure you keep them away from people that are coughing and hacking and sick, and keep that baby, away from sick people.
All right, John, Dr. Collier, good morning.
Yes, I wanted to know if you're a person who has quit smoking, how long does it take to get over the withdrawals from not smoking tobacco, as well as a cough that you may have started after quitting?
Okay, that is a very good question. The actual withdrawal period should be less than 2 weeks, but then there's the habits that you have learned that are associated with smoking. A lot of people smoke, say, when they have a cup of coffee or when they get in the car or even when they go to the toilet. Sometimes they light up a cigarette. So this is just a learned behavior, and you have to alter those behaviors and come up with something else to do with your hands and with your mind when you're doing that. But actual withdrawal from nicotine is a less than 2 week process.
All right, John, Dr. Collier, good morning.
Hey, Dr. Collier, I'm 32 years old, and I was racing my 13-year-old son, and now the back of my knee is swollen. Also, the front of it is giving me pain. Should I see a doctor for infection maybe, or should I just ice it on and off until it gets better?
It's probably not an infection in your knee. That's a highly unusual phenomenon. If you haven't had any surgical problems there, it can happen. But most of the time, it's just age-related, and you're starting to get some degenerative joint disease in that knee. So an anti-inflammatory such as Motrin, Advil, or Aleve should give you some relief. If that does not, then you can follow up with your doctor and see. There's a phenomenon with the back of the knee called a Baker's cyst. Sometimes you have to literally stick a needle in there and drain that to get some relief. But most of the time, an anti-inflammatory will give you all the relief that you need.
And, sir, call us back. Let us know who won the race. You're on with Dr. Collier. Good morning.
Okay, I have a question. You're supposed to listen to your body. If there's pain right up under in your back, are there any concerns I should have if there's pain up under your right rib in your back?
Yes, that is actually fully associated with gastrointestinal problems, particularly a gallstone. So that is one of the things that needs to be evaluated. It also could be a little in that area is your kidney as well. A lot of people think their kidneys are lower than that, but they're in that area called the flank. And one way you can determine that is just percuss it, i.e. just hit it with your fist or have someone do it gently. And if it gives you increased pain, then that needs to be evaluated. If you've had any changes in your urinary flow, the color or smell of your urine, or if you have blood in the urine, then that needs to be evaluated as well.
Everybody know how you can be reached.
Rickey Smiley, you can reach me on all social media at Ask Dr. MJ. We have Facebook Live tonight, 6:30 p.m. Eastern Standard Time. Just go to Facebook, Ask Dr. MJ, and you can tune in and ask your healthcare questions.
Hey, yeah, y'all make sure y'all tune in. Those Facebook Lives, I be on there watching Dr. Collier.
I know you are. When we saw you logged in one time, we didn't think it was you. I was going to put you on, but they thought it was somebody that was going.
No, it was me.
I know. So if you get a chance tonight, please tune in. These are the opinions of Dr. MJ Collier, not those of Rickey Smiley,
hey,
the Rickey Smiley Morning Show cast or production crew. Yes, sir.
I thought you were going to say these nuts.
I was waiting for it.
These.